We're going to have a fantastic day, some thought-provoking speakers, and today is really your day. This is all about you in the audience.
As you hear the reflections from our wonderful speakers about nurses, midwives and your value, fill your cup with their gratitude and their anecdotes. Couple it with some newfound swagger that demands the attention of decision makers, and let's build the revolution that ensures we're respected with proper pay and conditions.
This isn't about being saints. This is about leaning towards the good and honouring it in ourselves and honouring it in each other.
Julia Bear was amazing.
Oh, dynamic. She was just absolutely inspiring.
I'm now going to start looking for grace in everything.
Because sometimes we don't realise how much we make a difference or how much of an impact we have on patients.
We can't underestimate the importance of those factors: kindness, being empathetic, the leadership that we provide, and the accountability and that focus on the people in front of you.
We had to be very united. We had to take ownership of what we wanted, and that's my challenge to you today. Decide what you want, take ownership of it.
It's eye-opening, the Fiji one especially.
We need to unite for the nurses' rights.
That can-do mindset is what matters, that we can bring a change in future. Nothing is impossible.
We're standing up in this nation's rising labor movement, linking arms with all workers, organizing, bargaining, and striking for their rights, because that's the kind of solidarity it takes to win systemic changes.
We have really big inequalities in the labour market. Fixing these issues is not just a women's issue. I think this is an issue which clearly is a union issue, and it should be an issue that governments are looking at in terms of their programs and their expenditures.
Fantastic. It's lovely. I've learnt so much, even from the midwifery side of it.
The world needs 900,000 more midwives. And so we need to increase our investment and commitment to midwives if we are going to achieve those sustainable development goals.
Aboriginal and Torres Strait Islander communities have been living off hope for far too long. Our people need non-Indigenous peoples to be courageous and hungry for change and keen to be truly committed to follow us.
Sydney, obviously, and a lot of regional areas of New South Wales are facing an affordable housing crisis, but this is really an increasingly global issue.
It's just not achievable to buy a house at this stage.
Looking into the future, my partner and I, we just really don't think we can afford to live in New South Wales.
The housing crisis presents a policy challenge of extraordinary urgency, and it really demands bold political, community and industry leadership.
I know so many nurses I went to university with that have gone to Queensland. It's just more affordable.
We need housing where people want and need to live, and it's a fundamental human right.
And Liz Ellis, she was a card. She was so funny.
Oh God, it was so nice to have a laugh at the end of the day. And honestly, she gave us a lot of food for thought.
I think anytime you want to do something worthwhile, there's always obstacles. And if you say, oh, well, there's obstacles, it's all too hard, nothing is ever going to change. The people who make things change are the people who don't accept no as the end. They're the people who go, right, what's the path? How do I get to yes?
Listening to Liz Ellis, I thought that she was very inspiring about looking at a team approach to obstacles and looking at them as a pathway to not just be defeated, but to continue going.
So helpful, really good reframing, and gets you a positive spin and aiming for what you can do rather than just bitching and moaning about what's happening.
What truths do I need to hear? And then what behaviours do I accept, either of yourself or the people around you?
Awesome.
Don't let obstacles get in your way.
No one knows more than me that pay and remuneration is a key issue for all of you right now.
I think he was in a pretty hard spot. He kept repeating himself, and I think he needed to just say, I'm sorry, I can't deliver on some of the things.
I know he said, I'm listening, but I think he needs his listening ears on a little bit more.
Today I am pleased to announce that the next 12 sites have been identified to roll out ratios across New South Wales. And pleasingly, this will include regional and rural locations.
They have done so much for us, and yet they really haven't done enough.
He danced around the subject
He used the ratios that we've given you ratios, and that they've got rid of the pay gap as an excuse as to why they can't give us more.
You might have given us ratios, but to make ratios work, you're going to have to pay us to sustain our nurses. So you better give us our 15%. We need more to enable attraction to this profession.
How can the New South Wales Labor Party refuse our 15% pay claim to bring us in line with other states and prevent the exodus of nurses from New South Wales Health?
Whilst we haven't landed on the figure, I'm asking you to also understand that length of wages capping and wages stagnation in a single year is challenging for a government.
I don't see 15% for nurses as a big ask. We're just wanting what's owed.
What I'm saying to you is, though, we remain at the table.
We rise together. Today and every day, we commit ourselves to achieving justice, fairness, equality and dignity for all workers by enacting the values we seek in others.
Together we face many threats. The threats of ratios not being realised soon enough, the threat of your pay remaining low, and the threat of paramedics doing nurses' work in ED. We can choose to deal with these barriers. We can choose to be united. We can choose to take significant action. We are stronger together, and together we will fight, and delegates, together we will win.
We need to be ambitious. The future of nursing and midwifery relies on us. We need to be bold and brave. We need to take risks, and we have to do things that we haven't been willing to do before. We will demand that decision makers value us, and let's be a force to be reckoned with together.